Great, thank you. Do we have a quorum at this point? I believe we do. Yes, it appears we do. Welcome to the January 20th, 2022 meeting of the Council on Developmental Services for the state of Connecticut. Before I start the meeting, I'd just like to let all of the members and the public know that this meeting is being recorded as per Public Act 21-2. And the requirement for Public Act 21-2 is that every person who wishes to speak must first identify themselves before they speak. So if you think of it this way, that this was an audio recording of the meeting and you are on video too at this point, but it was just an audio recording. We want to make sure that we understand who is speaking at that time. So please, when you speak, say your first and last name and then continue with your comments. So I do want to let folks know that this is being recorded and will be a public record under FOI under Public Act 21-2. Also, if any member of our council unfortunately disconnects due to a technology error, we are not required under the state statute to adjourn the meeting. We are still in a full council meeting at that point. So I just wanted folks to know that that's also included under Public Act 21-2. So I believe that covers all of the housekeeping. So we'll get started with our meeting. So the first item on our agenda is we'll call the meeting to order at 4:32 p.m. On Thursday, January 20th, 2022. At this time, we do have a quorum, as I mentioned before, and the attendance is being taken care of by Joseph in the Commissioner's office. So thank you, Joe, for doing that. First off on our agenda is a moment of silence for individuals affected by COVID-19. Thank you. Hopefully we won't have to continue doing this, but we keep our thoughts and prayers for folks who are battling this disease, and we hope that we come through this at the end of this long, strange journey. I'll leave it at that, as a famous Grateful Dead song. So moving on to opportunity for public participation. So are there any members of the public who wish to address the council? If you do, please state your name, and then you have 3 minutes to address the council. Is there anyone want to speak? If you have functionality to raise your hand, please do so. If you are on the phone, please *6 to unmute yourself. Last chance. Any member of the public wish to address the council? All right, seeing none, I'll close the opportunity for public participation. Moving on, we have received the minutes of our previous council meeting. You received December 16th, 2021 minutes. Are there any additions, correction, or deletions to the minutes? And I believe Joe is sharing his screen right now for public record of the minutes. Joe, if you are, oh, there you go. They just popped up. Perfect. There was a delay. Any additions, corrections, or deletions to the minutes as presented? These will also be available on the website once they're approved by the council. All right, seeing none, is there a motion to approve the minutes as presented? Once again, please state your name and then make the motion.
Deb Ullman, so moved.
Is there a second to the motion?
Adrian Benjamin, second.
All right, are there further discussions on the motion before us? Hearing none, all in favor signify by saying aye.
Aye.
Or raising your hand.
Aye.
Aye.
All right, it looks like we have a unanimous vote by the council, so we do not have to do a roll call vote. So chair votes aye, and the motion passes unanimously. Thank you. Moving on to the next item on our agenda is the ombudsperson's report. I would like to welcome Shannon Giacovino, ombudsperson for the state of Connecticut DDS. Shannon.
Hi, everyone. My name is Shannon Giacovino. I'm the ombudsperson for DDS, and I sent everyone on the council my January report. Is there anybody who didn't receive the report? I emailed that out yesterday.
Correct. Yep.
Patty, did you not get it?
Patty, you're on mute. There you go.
I don't remember seeing it come through, Shannon.
Okay. Okay, maybe what I can do,
I
my
can stand up.
plan for today was not to go through the entire report, but to address some of the questions that came up and the suggestions that people gave when I sent the report. So Patty, I will email you the entire report when the meeting's over, just so I can get through, or after my report, so we can get through this part. When I sent the report, there was a suggestion that maybe I could sort of walk through how I had supported or worked with people who had called the office. And then there was also a question about what augmentative alternative communication was. And so I'm going to try to, I'm going to walk through two situations. And if anybody else has any other questions, I'd be happy to answer them. I'll start with the one where I got a call from a gentleman whose 25-year-old son resides in a CLA in Colchester, Connecticut. His son is nonverbal, and he communicates primarily through a little bit of American Sign Language and then a lot of his own sign language, which his father and an aide that's been working with him since he was 3 understand. They understand his signs. His father has cataloged his signs, but with the short staffing due to the pandemic, there's been a lot of turnover in his CLA. So a lot of the people who are coming and working with him don't understand his signs. And that's obviously very frustrating to him because he can't communicate with people. And so I really don't like to use this word, but he's of course having behaviors. And so the dad reached out because he wants to have his son evaluated to see if there is a communication device that he could use that would help him to be able to communicate with his the people who support him. And so augmentative alternative communication is our systems or devices, excuse me. I apologize, I have a dog that's barking. They are systems or devices that help people who have either limited speech or who are nonverbal. And augmentative devices are used to try to enhance or to support natural speech. So it could be like a speaker, or, I mean, I'm sure there's plenty of other devices that I don't know anything about. An alternative device is something that that is an alternative to natural speech. So, the keyboard to text devices, other devices like that. So for this gentleman, I started with his case manager had actually referred him to me. So I started with reaching out to NEAT to see, what the process would be for getting an evaluation and what happens from there, getting all of the information. The father had indicated that maybe they could private pay, but I wanted to find out how much that would cost so that, he was prepared. And the next steps that I've taken, because the cost is, I think, maybe more than he's expecting, was to reach out to the region to sort of see if DDS covers the cost of the evaluations, if the DDS would cover the cost of the devices. And so right now I'm communicating with the region to see what the process is. And then from there, I'll get back to the dad and give him the information that I have. And his case manager is also included on the email. So hopefully I'll be able to work with the two of them to get that process going. So that's one situation where somebody reached out. Another situation, and I'm highlighting this because it goes to one of my areas of concern, was I got a phone call from the sister of a gentleman who receives day supports. And he came home from his program, he came home from his program with COVID, and the whole family got COVID. And when the sister reached out to the program to notify them that he had COVID, so that they had a heads up, and asked if anybody else had COVID. The program initially refused to give that information. When she pressed further, they admitted that there had been other people in the program who had COVID the previous week. And she just had a lot of difficulty getting information. The program did not notify families that there were people in the program that had tested positive for COVID. And so she was obviously upset, and she was having a difficult time reaching her case manager. She had reached out several times, hadn't heard from the case manager. So I reached out to the assistant regional director, and we have been working through that process. I also made a report. I felt as a mandated reporter that I had to call AID to let them know that the families had not been notified that their loved ones had been exposed to COVID, and I encouraged the family to do so as well. So we're still in the process right now of, the assistant regional director is working with the program, making sure that they're communicating with the family. I think the program is reviewing their communication protocols and hopefully their COVID protocols. And the assistant regional director is also sort of trying to get to the bottom of why it was so difficult for that person to connect with their case manager. So it's a work in progress. I think someone had asked how I have found working with DDS on these issues. And I have to say that with every single case that I've brought to anybody within the agency, people have been very open to discussing it with me. There hasn't been any defensiveness. There hasn't been any reluctance. I mean, I really do feel that across the board, whether I'm talking to regional directors, case management supervisors, to the commissioner, to the deputy commissioner, to really everybody within the agency, that I think there's been a real openness to try to work through. I think people want to work through issues when they come up, and they just don't always know about them. So those are two examples. I don't know if in looking at the report, people had other questions about anything specific. If people wanted to discuss the areas of concern that I highlighted, I'm very concerned about the staffing crisis and the impact that's having on people's ability to get the services that they need. I think, I've heard in meetings, I've heard from providers, and I've heard from families that it's having a disproportionate effect on people who have the greatest need, which is very concerning. And I don't really see any end in sight. So I'm worried about people who need the supports now. I'm concerned about people who are going to graduate at the end of the spring. I don't know that they're going to be able to find the supports that they need, even if they have funding. And so I'm very concerned about that. And I see how this is impacting people in so many different ways every single day, and in just about every conversation I have. I had a meeting this afternoon. I was part of a provider meeting, and so many of the they are just stretched to their limit. I think they're doing the best that they can, but without staff, it impacts their ability to support people and to run the programs, the way that they should be run. I think it also has a huge effect on the provider's ability to offer real person-centered supports, because I think, in a lot of places, programs are in crisis mode right now.
This is Kevin Zingler. Does anyone have any questions for the ombudsperson? Shannon, thank you for your report, Shannon. It was very thorough. I know there were some great comments that were sent over via email, and I appreciate those comments and you addressing them. But anyone want to speak? I see Rick Lenz, you have your hand up. You have the floor, Rick.
Yeah, my name is Rick Lenz. Shannon, I just wondered if you have any trouble contacting people when you're trying to follow up on these. Do people return your calls and so forth promptly?
I've across the board, whether it's within DDS or even outside of DDS, people have been very responsive in getting back to me right away. I haven't had any issues with that.
That's great.
Yeah.
You're a very persuasive person.
This is Kevin again. Once again, any other members? I see Adrian, you have your hand up. Adrian, you have the floor.
Well, first, Shannon, I really like the way you're handling those cases. I'm very impressed. I'm not surprised, but I'm impressed. I just had one suggestion for the report, and this is something Ed used to do. I'd forgotten about it when we talked about this last time. If he got 6 calls about case managers, he would write 6. So he would document the amount of calls, and that helps us see, you know, if 1 month there's 45 calls about case managers, we know something's up. If there's 3 calls, we go, okay, that's just something. So, and obviously a call about a case manager or about, could be anything, but I just think it would be helpful to give us a sense of how many, because I assume when people are calling the ombudsman, they're complaining for the most part, or need help, obviously. So I would like it if you could add the number of calls.
This is Shannon addressing Adrian's comment. That request came from another member of the council as well, and so I'll include that in my next report. I will say that in looking at these issues, there are some issues, you know, there are sometimes multiple issues in one phone call and several phone calls that span, you know, different issues. So, you know, I'll do my best to try to keep a good count for you.
This is Kevin Zingler again. Is there any other further comments or questions for the ombudsperson? If so, please raise your hand, *6 if you're on the phone, and you need to unmute yourself. Seeing none, we'll close the ombudsman's person's report. Thank you, Shannon, for updating the council. We look forward to our continued partnership with you and your office and helping to improve the quality of lives for the individuals that DDS supports, and keep up the good work. Thank you for everything you're doing. Moving on, once again, this is Kevin again. We're going to move on to the commissioner's report. Commissioner Sheff, welcome.
Thank you, Kevin. Jordan Sheff, Commissioner at DDS. What a month. So I'm going to try and cover 5 things today, but leave time for questions. So the first thing I'll talk about is the Omicron variant. We had to make some decisions, not knowing a lot about the outcomes of severity of illness regarding Omicron, the transmissibility, some of the safeguards, and we are fortunate, as we are now on the rather steep decline that mirrors the steep rise in cases, that most of the outcomes, in fact, there were very few extremely adverse outcomes with Omicron in terms of health outcomes for individuals we support or staff, as long as they were vaccinated and boosted. 2 years ago and last year, when we talked about the population we support at the department, we talked about vulnerabilities to this population. And while I won't dismiss them, it was very clear in the data, both for us and statewide, that the vulnerable population, as the governor has said and others, is the unvaccinated population. It is not any more pronounced in the IDD community in terms of severity as it was a year ago. So we're fortunate for that, but we didn't know that going into the rise. And there was, and the rise was so fast and so steep, much more so than last winter for us, that getting ahead of it was entirely impossible. With people living in congregate settings and staff having to move in and out of buildings and such. I think at the peak in our public operations, we were operating just COVID-related absence at times as high as 25% absenteeism. And that's on top of vacant positions and an already stretched thin staff, use of other sick time, use of FMLA, other reasons people are on leave. while I don't have the hard numbers for the private sector, I would suggest that they were as bad or worse at times, just because I think their staffing was in worse shape. They had vacant positions even more so than us heading into the surge. And they are still reeling from that, as Shannon alluded to in her report. The impact of COVID on top of an already stretched thin workforce. I'm going to pause along the way because let me just say one more thing about Omicron, and then I'll ask if there's any questions specific to that, and then I'll move on if that's okay. One of the hardest decisions I've had to make throughout the pandemic is the closing of respite centers, because I hear about it both from staff and from families and from people we support, how devastating that can be. Unlike last year, where I made the decision purely for staff purposes and also because of the dangers of mix of pathogens coming into the house and not being able to test and screen. While we had no adverse outcomes, this particular time, I was really scared because even with masks and even with the other safeguards, even with all of the PPE, we know that Omicron was getting by all of our best defenses. And I would not having test kits on hand to be able to test people coming in, and knowing that the positivity rate as published was 25% at times. So with all the at-home testing and people not able to access tests, you assume it's higher. We made a decision based on health and safety, which is ultimately one of my top charges, and we made that decision. It was unpopular with a lot of people. My medical staff, the epidemiology staff were thrilled with the decision for the most part, but a lot of other people, were disheartened by it. The good news is we'll be able to reopen the second weekend of February. I think in each of the other pauses on respite, it was months at a time, and this will be just about a month of closure. And we will have test kits to be able to assist families with self-testing in the parking lot prior to admission. Test kits that can be administered if someone becomes symptomatic after arrival. And of course, our staff are vaccinated, and we have proper PPE in place. So hopefully we see this Omicron start to continue to trend down. Our absentee rate today in public was at about 12%, which is down. That's great compared to where we were just a week ago. And hopefully that number will continue to come down. So let me pause there. Are there any questions on Omicron from the council? Adrian?
Hi, Adrian Benjamin. Thanks for that, Jordan. I'm confused about what the quarantine time is, because at my daughter's house, which is a Hark house, I had just read an update that it was 5 days, not just from the CDC, but from Connecticut Department of Public Health. But the house, and it's better to be safe than sorry. So, and obviously they have, unlike my daughter, most of the residents there are quite old and more fragile. But they were using they are using the 10-day quarantine. I'm just confused what DS's position is.
The issue, and I'm not an expert on these rules, but I'm going to do my best to recall them, and we can follow up and send the council, Joe and Kevin, if we can send the council the actual guidance. We set the bar at the minimum. Providers can choose to have a higher bar than we put in place. So that's number one to know. Number two, as I understand it, the 5-day quarantine was for people who are asymptomatic, vaccinated and boosted, and was used mostly to return essential workers and healthcare workers and frontline workers to work. It was targeted to not break the economy, as I understand it. Not here in Connecticut at the federal level in the CDC. So I don't know specifically the circumstances in her house at that time and the vaccination statuses and the booster statuses, and if anyone was symptomatic. If someone's symptomatic, then it was still the same 10 days, with the last 2 being symptom-free. That's how I understood that. So if they're all together and any one of them was symptomatic, I would have quarantined the whole house till that. So I don't know the specifics, but we can, I think I have that right. But we'll get them out in writing to you, what we published for providers to utilize.
Okay, thanks.
And I think there's also a difference between ICFs, the directly federally funded facilities, and the expectations there versus community living arrangements and group homes, but I'm not positive about that, but it'll be in the guidance. Any other questions on Omicron? All right, the second thing I wanted to share is we did the two hearings for the 5-year plan. I had a better feel of it for the second one than the first one, so if you endured me in the first one, I apologize. I think I had a little more rhythm and cadence and knew a little bit more what to expect in the evening presentation. They went about as I might expect, and I'll be working with Kevin and Joe and Rod and Katie and others to incorporate the feedback that was provided at those hearings into the plan. These virtual meetings are hard. The new update that we're working, as Kevin began the meeting in public meetings to be recorded and announce your name and these rules, we're coming into compliance with that statute as we speak. So there's some newness to that, but there isn't, those of you who've been to family testimony, and I think as I'm looking around the room, probably all of you have, providers and families at the legislative hearings. There is a more comfortable give and take, and there's some camaraderie, and there's an energy that exists in those live and in-person meetings. It definitely felt weird to be holding those hearings and for it to be so very quiet and still, and not to see everybody at the same time, and not, so hopefully by the next 5-year plan, that's all better, and certainly by next legislative session, not the short session coming up, but a year from now, hearings will start to feel a little different. Any questions on the 5-year plan stuff? Rick, you're muted, Rick.
Rick Lenz, did you find the testimony by the council helpful?
I found all of, and yes, I found the council's testimony helpful, as well as most of the rest of the testimony. I think, yes, I found it helpful.
Good.
And we'll be incorporating, if not all of it, much of the feedback into aspects of the plan, or into the addendum that will go with the plan. I think I had a conversation with several council people prior to the hearings. And I think what's different now in strategic planning than when I went to school or when the statute around 5-year strategic plans was written is that the world just doesn't work in 5-year planning cycles. We're much more fast. And when you look at the analogy I used is the IT industry used to build giant monolithic software developments that they would deploy, and they would stage those out over a number of years. And the problem that they finally ran into is that by the time they built and implemented something, it was already out of date, because a 5-year window in today's world is too long a window. It also doesn't incorporate all of the circumstances that are far beyond the department's control. The will of the legislature, the will of the administration, the will of the federal government, the will of things like viruses and economies, CMS, stakeholder input, technology. So I think one of the constant bits of feedback, although it was consistent with the prior two plans, was there were not matrix, measurable outcomes, dates, numbers. People were looking for something more substantive there. I was reluctant to commit to things on paper for the sake of satiating that desire, only to either fall short or far exceed based on things far beyond my control. Whereas we can sort of, as we tackle and prioritize the things within the 5-year plan, we can target, much more specific, time sensitive, what the IT world would call sprints, or agile approaches to handling specific issues. And rather than put dates throughout the whole 5 years on different things, depending on where they're prioritized, we can continually update the document and set goals periodically, set targets periodically, set dates periodically as we're working to include more stakeholders in the development of the plan and the strategy. But yeah, I think we heard a lot from a lot of people, and I think a lot of it was very helpful. Even the people who weren't particularly happy with the department, it doesn't do me any good just to hear the good stuff.
Good.
Workforce. The department's been trying since before the pandemic and through the pandemic to help providers. Substantial infusion of wages. We've talked about that. Recruitment strategies, partnerships, Governor's Workforce Council, and we have not been able to stem the tide, not even remotely. And part of the problem is that we are now in competition with ourselves within the department. There's over 100 providers all competing for the same bodies, and the same staff being sought by DCF and its private partners, and DEMIS and their private partners, Veterans Affairs and their private partners, Corrections and their private partners. We are all fighting for the same workforce that appears to be non-existent. I hear from providers. One of the things that Shannon heard today, and I had summarized for me by the regional directors, is that one of the providers took time away from doing other things they could be doing to help the frontline staff, one of the managers, to attend to 6 interviews, and they were all no-shows. No one showed up for the 6 scheduled interviews that day. We've had similar, even at the state level wages, we've had similar struggles in recruitment and retention. So we'll continue. I have a meeting with the Alliance on Tuesday to take have a conversation with them about some of these issues. Some of the asks from the providers are things that we'll have to strongly consider, but there will be some reluctance and some reticence around to help them is delaying renewal times on trainings. We know we get ourselves into trouble when we don't provide training, but if I have to pull staff off the floor, I use that word from my institutional days. If I have to pull staff out of group homes or out of day programs to attend 6-hour days of training, it's going to be another cancellation for a family or another short shift at a group home. And trying to balance what of our trainings could be delayed or just grandfather, give people a 90-day window. But as Shannon said, I don't know what 90 days is going to buy us. We'll just can't see that in 90 days there's going to suddenly be a whole bunch of staff ready and willing to wade into the trenches with us. So we're evaluating all that. We are, we're trying our best not to beat up providers. I think the department has been successful in turning a relationship that was very gotcha and punitive, or at least felt that way to providers at time, to one that's more collegial, at least most of the time, and at least most of our providers would say that. I'm certain there's a few every day who would not feel that way, but I think most feel like we've been good partners and where we can give latitude. But the notion of extending retraining on things like abuse and neglect is not really an area I think I want to go. But we will be talking about it. Extending timelines on renewals for med certification. There are some people where they probably have been doing it 20 years. They could teach the class. They pass meds better than certified medical staff pass meds. But to pick and choose who will say, well, you can wait a few months or you can wait a few weeks, and who we can't becomes, as the unions would tell me, arbitrary and capricious. And so we're going to have to take a very measured approach to how we support providers on those issues and where we can find them latitude. We're in 2 years of pause on a lot of things, or intermittent delays, on whether it's licensing or quality assurance visits, quality service reviews. We know when we know that bad things happen even when we are bad things happen to good people even when we are looking. When we're not looking, we can only assume that perhaps more of that is happening. So, and we've had our, we've been trying to hold together a very fragile system, made more fragile by COVID and more fragile by this workforce issue. It is hard to drive up and down and around the mall area and know that retailers are, I think Target is very close to $20 an hour now. They've gone up from about 13 and a quarter at the start of the pandemic to $20 an hour. It's hard. And retail's hard work. I started my life in retail. I don't want to go back to retail, even for $20 an hour. But to compare it to the type of work that and the type of workforce necessary to do what we do versus what many of the staff at Target are likely doing it's two different things and two different levels of stress, two different types of stress. So we will continue to work. We're working with federal agencies, Department of Labor and the Governor's Workforce Council, and hopefully this segues to my next bit of conversation. Some relief is on the way. But before I move on to ARPA, I'm just wondering if there's any questions from the gallery on workforce. Rick Lenz?
Rick Lenz again. As far as recruitment and retention are concerned, I heard this week that the State Senator Kathy Austin is going to sponsor legislation supporting having a 4 to 6% annual increase in funding over the next 5 years. Do you think that would be helpful?
So I think 4 to 6. Would that be helpful? Yes, I think that would be helpful. I think I think the types of increases the senator's talking about would be particularly helpful to the private sector agencies who have only gotten targeted wage increases and are looking for offsetting other costs that have also steeply risen besides labor, whether that's rent, fuel, vehicles, buildings, the cost of advertising, electricity, you name it. The wages have been pretty targeted. The raises in both in the Malloy era and under the Lamont administration have been targeted very much at wages. And I think that what the senator is talking about would be helpful for sure. I think it will also be helpful to raise wages, but I think from a prior meeting, I don't think it's all about wages. I think that there are other issues at play from what I read outside of DDS about the workforce and the shortage of workers, that I don't know that $20 an hour in our sector is necessarily going to solve the workforce problem. I think we have a group of people who are not interested in being part of that type of work going forward. I think people want to work remotely. You can't do direct supports remotely. I think that people want to have a lot of flexibility. You can't have a lot of flexibility running a group home schedule or a day program schedule. I think people also want to work for themselves and in large part in cottage industry and entrepreneurship and a renewed spirit around that they'd rather make money in other ways. So I am hopeful that I think that the secretary has talked about an ongoing need to address this, that what she had done in the biennium was a first step towards a long-term plan. I think that the Senator Austin is also of mind that this is an area that they have tried to tackle and they've been able to do in fits and starts in very small amounts at different times. But as the governor said yesterday in one of his press pieces, the new economic reality in the Lamont administration is very different than the new economic reality that was around in the Malloy administration. He and the secretary have been able to create a rainy day fund. They've been able to level set pension. We are ending years in surplus, not deficit, without frequent and ongoing holdbacks and rescissions. So, maybe this is the opportunity and the time to do that, Rick. I think any little bit will help. But I don't know that it's all, and I think Rick Rothstein said this the last council meeting or one of the meetings I was at with the other Rick, that while pay is important, it's not all about pay. And I think that's been true for a long time. When I was at March and the wages were $10 an hour, we were pretty fully staffed, and you could go make more money a lot of other places back then. People wanted to do the work. The wages have steadily risen. They've intermittently risen now to $16.50 an hour, which is a 65% increase over where it was 15 years ago. But it hasn't. But the workforce issue hasn't gone away. I see Karen's hand up. Karen Levac.
Yes, Karen Levac here. I'm wondering if there has been consideration of consolidating settings rather than keeping things as they are in both public and private with these staffing shortages. Is that something that's being considered?
So I'll split my answer into two parts, Karen. So let me talk about public first. Public, as you're aware from your presence on the campus when you're able to visit your son, we have consolidated and rearranged things on an ongoing basis. Southbury continues to consolidate the number of cottages they operate to make efficiencies of public staff. The consolidating things we have done recently only out of extreme staffing need due to the dealing with the COVID stuff. Because the more people you pack into one place, the more likely you are to have a substantial outbreak. And for both the public and the private side, I will say consolidating, talking about consolidating locations is the opposite of person-centeredness. But sometimes you need to work based on necessity. And I know you know that. But so what we have done on the private side is, and I mentioned this during one of the 5-year report meetings, I think testimony from the ARC that I wanted to clarify, was that we have currently have a moratorium for the regions to initiate developments on CRSs and CLAs without central office approval. The reason for that is we have historic numbers of vacancies in our private group homes. Transitioning people into private services, one, while there's a pandemic, and two, while there's a workforce crisis, is really, really hard. Continuing to develop newer homes and newer CRSs when we can't fill the ones we have already and people are waiting on the wait list to get in there doesn't make a lot of sense. I don't want that moratorium to be long-term. I'm hoping that, we can get through the COVID, we can get through the workforce crisis, we can fill up many of the vacancies that already exist, and then we can look at further development. The other part of that is we have, like the Save Our project, which I think is in, I always get it wrong, and Steve's going to yell at me, but I think it's in Canton. Thank you, Christine. I got it right. Let Steve know I got it right. I didn't say anything bad this today. Those IDASH type projects, we have 4 or 5 of those coming on, and we need to make sure that we're filling those as well, and prioritizing who gets access to those additional developments that'll be coming online between 6 months and 18 months, and they're scattered around the state. And with all that we've asked, to answer specifically the question, with all those vacancies, we've asked the regional directors to engage with providers to see if there is any reorganization they can do between providers. We used to do it when I was in Rhode Island, and when I came to Connecticut, I asked then Deputy Commissioner Dupree to consider doing that. And she held a couple meetings, which we continued to try and do even after she left and I came on board. Providers historically are reluctant to give up their own and to take on new, or vice versa. The kind of thing we're talking about is so, let's say it's me and my brother living at 123 Main Street, and there's 2 vacancies there, and at 456 Main Street there's 2 other brothers, and we're all, similar in terms of how we might get along. We might be good matches. We're operating 2 group homes with 4 vacancies and the staffing needs of 2 overnights at 2 locations. Could 2 providers get together and say, well, we're going to temporarily shut down 456 Main Street till staffing stabilizes, and our 2 guys are going to move into 123 Main Street, and the 4 brothers can live together, and we'll figure out how to do that. And the department's really going to assist us in doing that. Those are the kinds of conversations we're trying to have. I don't know that they're going particularly well. I think that there are some providers particularly interested in that stabilization, and some other providers who aren't, not that they're not interested, but can't come up for air long enough to engage in those discussions. I mean, we're literally talking. It was one thing when I was at March and we were on the small side and very flat in structure, that I was pulling overnights and plunging toilets. Most of our agencies didn't have executive directors who were doing that anymore in the early 2000s. I think that was very much the way in the 80s and 90s for most executive directors. By the 2000s, there was enough structure in place. But I'm hearing that management, executive directors, admins, human resource people, abuse and neglect investigators are out passing meds, are out doing transportation, are out doing job coaching. And so to get them to a table to engage in that consolidation conversation is challenging, but we're trying. But we do think that's a potential solution. I just don't know how quickly we can realize it to have any measurable effect, Karen. I hope that answered. It was long-winded, but I wanted to get sort of the backstory behind it.
Well, I thank you for that, because I had heard some scuttlebutt about these talks going on, and I was wondering exactly what was happening. And just one other thing, a little bit off topic, is I'm getting a lot of feedback from parents in the community that they're having a very difficult time accessing case managers, especially through Mailgate. I don't know what is going on with that system, but they're very, very frustrated, and I'm getting a lot of calls, and if there's any other system that they can use, especially if they don't have a phone number for the case manager and that's their only way of getting in touch, it's getting bothersome.
So Joe, mark that as a follow-up for me with Wayne, just to talk to him about that. Thanks. I will tell you that globally, that we went from a horrible secure mail server to a horribler secure mail server. The one we used to have was frighteningly awful, and we found one worse. The one that they're using now at Demas is being run on a pilot. And we are hoping that we will be the next agency, or the second in line after that, to move off of the system we're on. A number of people on the call from my staff are familiar with a family who has spent weeks. They live out of state and spent weeks trying to get their password reset. And the problem is that we can't do the password reset. And some of the folks, some of the families who are using this, this is not meant as an ageist comment, but struggle with the use of technology when it's at its best. When it's at its worst, it's really a struggle. And so I had to have an IT person that I pulled from other work call and handhold this other person's, call them while they were working with a software company to get it reset. And it was really the only way to go about getting it resolved. So I'm familiar with that side of it. I will look into it. A number of my case managers have set up Google phone numbers so that they can have a phone number that they can get to. And staff are also expected to be in person soon, at least 20% of the time, which will give them access to their on-site voicemail, but they can access that on-site voicemail remotely. So thanks for raising that issue. And I saw Patty, your hand came up.
Yes, Karen, thank you. Patty Silva. Karen, thank you for bringing that up, because that was something that I had asked be added to our letter, the testimony for the 5-year plan hearing, because I have been having a horrible time. And I'm, usually pretty good with technology, and it's just so frustrating because you can't get, documents, things like that. It's great to have a Google phone number, but if you aren't able to access the documents that your case manager is sending, that's a big problem. So I hope that there will be some resolution to this soon, because it just, it's a huge communication gap for families.
Yeah, yes, and yeah, nope, I hear it, and I've been complaining about it for well over a year, trying to get us out from under it. I forget the one we had before SecureGate, or whatever the thing is called now, but I will mention it again to our IT department. Joe, if you can flag that one too for follow-up, thanks.
Commissioner, I'm so sorry. I want to make sure I have this correct. So Patty, what was that issue as opposed to
it was the secure mail.
Okay.
Same thing.
Issue.
Okay.
Yep.
Thank you.
All right. If there's no other questions on that, I have two more things I want to talk about briefly so I can turn the meeting back to you, Kevin, and give you time to do the rest of the work you have. ARPA spending. We are, the department is in, as all of the state agencies are, there's an effort and an energy to start kicking some of this ARPA money out, American Rescue Plan Act money, and the FMAP money, the Enhanced Federal Matching Program, but it hasn't been encumbered yet. And part of it requires us to do some work. So for instance, I believe our modifications to Appendix K of our waiver, that there's a period of public comment right now, which could then be followed by a legislative hearing process, and then 90-day approval process from the feds. So we want to get this money out in a lot of different ways, and we'd like to get it out yesterday, and we're trying to figure out what we can get out and how we can get it out. Large portions of that, which we'll be able to spend over a multi-year period, are targeted at workforce development training, retention and bonus type things that we provider stability payments. There's a number of ways we'd like to use that money to solve some of the problems we have talked about tonight. But we're not able to spend all of it in the manner that it was articulated yet. So I just wanted to give a quick update on that, and it may help to invite Krista to the next council meeting if you would be interested in having her to talk about the ARPA funding and the ARPA spending plan. I think it would be of interest to the council to hear more details on that. The other nice part is, because it's multi-year, is if we've missed some things or want to change some things, it is modifiable, the plan that we submitted, but it requires permissions from the feds, and that's rarely quick and easy. Although they have been much faster at helping us in the last few years, to be quite honest. They've been much more responsive through some reorg. And then the last thing I have for you tonight is, in addition to the fine work my latest hire has done, Shannon Giacovino, and it really has been great to have her aboard, and helping me and helping you and helping families and providers in the manner in which she has. We started another position. I apologize. I have a dog who thinks it's dinner time, and he's right, but he's going to need to wait till I can finish this comment. He is a woman named Cheryl Ellis. Dr. Ellis has come on as our Diversity, Equity, and Inclusion Director. You'll remember some not favorable news prior to the pandemic, with some stuff going on in some of our public programs, and at the same time there was a lot of Black Lives Matter protests going on at the same time, a lot of unnecessary deaths, and all of that national conversation is going on, and so we started to look for a DEI director at the start of the pandemic, and it just got set aside. We went through an entire recruitment process, and while we found some fabulous candidates in that process, we didn't find the candidate in that process. And to do this and to do it right. In any case, she started. She's going to split her time roughly 50-50 between department and staff related internal business with regards to diversity, equity, and inclusion. But she's already working with Josh Scalora, who you'll remember from our business intelligence unit, and getting networked with other DEI staff in the state, as well as there is a DEI, the NASD's National Trade Organization I belong to, has a DEI subgroup, and she will be participating in that, looking at issues of equity and justice in terms of from the perspective of families and service recipients within the Medicaid business. And so we are thrilled to have her aboard. She's very excited to be here, we're excited to begin that chapter for DDS in a more meaningful way, revitalize some of the things we used to do better, and learn to do some other things even better now than we did previously, and grow together in that way. So that was, I'd like to finish with something that's positive. And so I'll stop there. Any questions for me?
I see, this is Kevin. I see Christine.
Hi, my question was on the previous issue, Jordan, and I don't know if it's something that's even short enough to say, to give a quick verbal answer, if it has to be something that's in writing. But on the mailgate system, are there things that can be communicated between the caseworker and the families that don't have to be sent through that?
Here's the easy answer. It's an automated algorithm that determines when it's going to send secure and when it's not. So what's frustrating is, and I'll give a real clear example. Former executive director reached out to me by email, wanted to check in and see how I was doing, if he could lend support, and said, "Do you want to meet and have lunch?" And I said, "Sure." He couldn't read that message because I responded "sure" to an email that said, "How's 12 o'clock at Red Rock?" There was no social security number, there was no date of birth, there was nothing, and that went out through secure. And I can't tell you what the algorithm is or why. And then there's other things that go out and families say they don't have any issue with, and it's got all sorts of HIPAA protected information. I don't know the rhyme or reason. So there are, on a very limited basis, there are a number of staff who can trigger it to bypass the mailgate system, putting something in the subject bar. But I have to wash it of anything. Like I have that functionality. I can send something not securely, but I have to wash it of anything potentially HIPAA. And even if the family waives their HIPAA to me and says, "Don't worry about it, send it not secure," I'm fine with that. The state doesn't, given the HIPAA laws, doesn't subscribe to me doing that. So there is a way for a limited number of staff. If we gave it to all staff, everything would go out not secure all the time, because you never know what's going to be secure and what's not, and that would defeat the purpose of having secure email access.
This is Kevin Zingler again. Any other questions for the commissioner?
Rick Lenz?
You're muted, Rick. This is Kevin.
Just a quick question. The list of topics for you to address tonight includes the ID partnership grant update. Is that something that's not moving, or?
So we're going to invite Amber and potentially Katie Rock-Burns to come in. We want to revamp a little bit of that, and we have not been able to really focus on it. So I asked Katie if she was prepared to talk tonight, and she asked if she could buy one more month. So she and Amber will be ready in February, Rick.
Great, thank you.
Did I get that right, Joe? Yeah, all right.
Thank you.
This is Kevin Zingler again. Is there any other questions for the commissioner? Commissioner, I just have a quick comment, I guess a thank you on behalf of all the providers and everyone in the state. DDS did give all the providers, and I believe public too, obviously, N95 masks and test kits. And those have been a real game changer for not only bringing staff back and testing individuals served, but really providing a lot of security during this unforeseen time. So I just want to comment and just thank the agency for doing that, because obviously, you know, going out to Walgreens or CVS or getting 5 test kits from your municipality doesn't really get you that far when you have a workforce crisis. So thank you on behalf of all the providers and also the families for getting those test kits out to people in a timely manner.
So what I will tell you is Santa can't deliver presents without a lot of elves. And Chief Baldwin, who's my chief elf, and a whole slew of people throughout the state have helped ship. I think we're up to now roughly 30,000 test kits, which is 60,000 testing opportunities, and an equal number of N95s. In the for the self-determination program, they're getting mailed directly. The first batch went out today. The rest hopefully go out Friday and Monday. Anyone who's been a direct hire on record of pay, you know, as a payee in the last 2 weeks will receive test kits and N95s directly in the mail at their address. So we're doing that as well. I often get reminded that I leave the self-determination program out, so I made sure we subscribed and getting some assistance in doing that. But I wish it could have been sooner, but we got them out as soon as we could, and we'll continue to put them out as long as they're made available. And I believe they were made available to providers and EORs at no cost.
Yes, that's correct. Thank you. All right, seeing this is Kevin Zingler again. Seeing no other questions or no other raised hands, so thank you, Commissioner, for joining us. We look forward to next month with some of your suggestions of Katie Rock Burns and Krista and maybe Amber, depending on how we decide to lay out the agenda. Some great opportunities for us to have a further discussion, and thank you for all that you do to keep people safe during this pandemic. So thank you again for joining us. Moving on to the next item on our agenda, our legislative breakfast. So I think this is maybe premature, but I don't know where the session is going to go. I don't know if Kevin Bronson is on. I know he's on the line, Director of Legislative Affairs for DDS. If he has any updates, I guess what I'm trying to figure out is, do we need to reserve somewhere, sometime, at least get on the calendar with the understanding that things may change virtually in the future, but at least we may be able to get a prime spot if we need to do that. I don't know, Kevin, if you have any updates on the legislature and what they're planning to do. I did see on the website, the CGA website for the legislature, that the building has reopened on certain days of the week. I think it's 2 days a week, but I'm not sure if that gives us an opportunity to reserve something or to have any of these gatherings at this point. So I'll defer to you.
Sure. Kevin Bronson, DDS, and Kevin Zingler, nice dress
Yeah.
wearing today. See, obviously the Kevin's got the message. Anyways, yeah, so what I know about session right now is it sounds like they haven't given a determination yet of what's going to happen, right? But it's probably, my gut is it's going to be some sort of hybrid style system. I don't necessarily know if a hybrid breakfast would be possible, just based off of, you know, technologies over at the LOB cafeteria, as we all know. They probably still have the same furniture from when they opened. But anyways, so I don't know. I quickly looked at some dates, because I know I mentioned that I would give you at least some times, and I would suggest sometime, like I said, in March, the cutoff for the Public Health Committee, like when they're normally busy, right, is the cutoff for bills is the end of February, and the joint favorable deadline, which is like when the bills have to get out of the committee, is in the end of April or the beginning of April. So I would say sometime in the middle of March to do something. I'm happy. I don't know who I'd reach out to at legislative management, but I'm happy to find out. I know that nothing's going on in the building other than just meetings and tours. So, but I like the cafeteria is not open. There's nothing, you know, like that sort of thing.
This is Kevin Ziegler again. I think that maybe we should take a look and see if there is any calendar or any reservation system, even if it's tentative. I agree with you. I don't think we're probably going to gather in masses, or we're going to have the opportunity to do what we used to do. But we can at least maybe put ourselves on a calendar at least if they are taking reservations. If they're not, then we move on and we figure something else to do as a council. We do want to do some awards at this legislative breakfast like we've done in the past. We want to honor some self-advocates. If not, this is the year to probably do it. Not only our DSPs, but our self-advocates and all the yeoman's effort over the last year and a half, 2 years during this pandemic, to recognize some folks and also some legislators and some individuals who have really stabilized services over the last 2 years. So I think we definitely want to do something as a council to recognize those efforts. And if you want to just reach out and see if they are taking reservations, if they're not taking reservations, that's fine. It is what it is. If they are, maybe put us on the calendar, or maybe we're the first ones on the calendar. And if something opens up and March comes around and we're having the parade in Hartford and things are back to whatever we call normal, then maybe we will have some kind of event at the Capitol. But at least we're on the docket, if you will. So I don't know, are there other thoughts from council members at this point? Christine, I see your hand raised.
Hi. Yes, Christine Hainsworth. And I'm just wondering, sometimes we tied this in with the ID caucus having some kind of a hearing. Is the ID caucus alive and well and you're doing something at this point?
This is Kevin. Kevin Ziegler. This is a really good question. I don't know. Well, I guess we'll have to find out and we can report back next month.
Yeah, this is Kevin Bronson, and in all seriousness, honestly, this is my first time hearing about it, so I don't know the answer.
So why don't we, this is Kevin Ziegler again, why don't we take a moment, take the month, if you will, to get some more information. We'll report back at our February council meeting. If we have some dates and Kevin's able to reserve a date on the calendar, maybe we can do that via consensus over email. Just to at least put us on the calendar in case things really do open up or things get back to sort of business as usual, if you will. Or at least have our name on a reservation at that point, and we can go from there. Other questions? Adrian, I see your hand raised.
Well, I think the reality is the IDD caucus is probably, I assume some one of us, because we're all involved and know our legislators, would be aware if the IDD caucus was doing anything. And I haven't heard anything. Has Patty or Christine, or maybe Christine has?
I just heard rumblings from some people about something in February, just this week. So I don't know if it was just a hope, a wish, or a thought to be thinking about, but I did hear just something in passing from a couple of people in conversation. So,
well, it'd be great to find out. So let's all put our hats on and try to find out. I know that HARC is having their have a HARC day on February 14th, on which they do every Valentine's Day, but it's virtual and it has nothing specifically to do with the IDD caucus. Is there anything else planned that anybody knows about? Okay.
This is Kevin again. Rick, did you want to say a few words? I saw you light up there. Rick Rothstein.
I think we probably won't know what's going to happen in the building till the legislature gets ready to gavel in, which is February 9th. Next month's meeting is probably a good time to take this up. But if Kevin Bronson can find a date that we can put a lock on, that would be fine.
Okay. All right. I think that this is Kevin Ziegler again. I think that gives enough direction for us to at least pursue some options. And if folks hear of anything about the ID caucus or legislative openings, please let us know via email, and then we can figure out next steps and talk about it further in February. So we'll do that. Moving on our agenda, legislative session. So I think we wanted to get down into some discussions with Kevin and his team at DDS. I know that the governor usually releases his budget. I believe it's upcoming. I could be wrong, but I believe it's in the next week or two. So we'll know more about the priorities of the administration. And I didn't know if DDS at this point has any legislative priorities that they were wanted to share with us. I know that I believe in years past, they had to be submitted to OPM and some other folks in December. And then this might be a good time to sort of talk about some of those priorities if we did that. I know there's probably a lot of holdovers from last year because of the pandemic. But any updates, Kevin, your team that you wanted to provide us, and then we can talk about it further, obviously at a later date too.
Yeah, sure. Kevin Bronson at DDS. So last year was the most exciting year. I mean, I came in right at the tail end of session last year, and what Rod and Krista did, I can't take any credit for it, is they passed our agency bill, which we've been trying to pass for a couple of years now. And so that was the big thing that happened, which passed and got signed by the governor. This year, I could be wrong. I could check with Rod. I could be over speaking, right? But we don't really, we don't have anything too big this year. I'm going to make, and this is what I mean, joking aside, I think our biggest thing that we have is a tech change adjusting doctor to medical professional in the DS Council. I think we had that conversation here a couple months ago, to open that up to a wider group of medical professionals, right? But it's mostly just, it's mostly tech changes. We had to submit our bills to, I think it was Public Health or DSS. And they were, this year's what they're trying to combine the bills into HHS, Health and Human Service bills. So we would be, rather than DDS having their own bill, like in years past, we would have a Health and Human Service bill where we'd have a portion of a bill. And you could look at it, as a positive or a negative being, tied in like that. So, but the only other big update, I guess you could say that's not necessarily a legislative update, but I talked to Rod, and Rod and I are planning on starting session. We're going to put out a weekly legislative update. Nothing too, I don't know what he's done in the past. I haven't seen what he's done in the past, but basically my plan is it's just going to be a quick little summary. It's going to go to everyone, not just the council. It's going to be more open to public and everything like that. And it's just going to have a little descriptive blurb of what happened in the past week and some bills that we're tracking. And that's basically it. I think that's it. And anyone has any questions, I'm here.
Great, thank you. This is Kevin Zingler again, and I appreciate that email blast. I know that Rod used to do that in the past to the council, and I think it went out to the whole world too. And it was very helpful, I think, for families and individuals to understand when hearings were coming up, what bills were of interest, what ones they were tracking. And obviously, as you guys go through the session, there's always those aha moments where did that bill come from? And there's a bill that's proposed, and people need to know about it and either testify for or against it. So I think that's a very helpful process. I think also on the DDS website, you guys used to post those weekly updates, or at least a running list, if I recall. Just these are the things we're keeping tabs on, or these are the things we're learning about as we go through. So, so that'll be very helpful. Other thoughts about the legislative session upcoming that we can, Kevin, go ahead again.
Yeah, Kevin Bronson again. I just want to add to that just a little bit. Is that I mentioned on the rack is that I was on North's rack last night, and one thing I mentioned is just kind of bear with us a little bit, because we are in the process of updating, and this is not really legislative, but it kind of ties in. We're in the process of transitioning over, updating our website, and putting in a email sign up page and stuff like that. And it all is, one thing needs to happen before the next and the next and the next. So I guess I've been telling people, just bear with us. We don't have a email list per se, so we're just sending it out to a bunch of different things, and the email that I send out to you about legislative update, if you have people that you feel that should be getting it, feel free to send it along. We're going to have to play this little phone tree for a little bit longer until we have the sign up, because the way it works is FCC rules require an opt-in for emails. So I can't just take all your emails and say, sign me up, put all the council in. I can't do that. Each and every one of the council members and members of the public have to opt into the list. So it's a problem that I hope to be fixed in the next couple months. So just bear with us.
Okay, thank you. This is Kevin again, Kevin Zingler again. Is there any questions or comments for Kevin Bronson? All right, seeing none, we'll move on to our next item on the agenda. Thank you, Kevin, for your report. Topics for future council meetings. So we had a large discussion. I know during the commissioner's report, there were some guests that we'd like to invite back. Amber Burke, Krista Oshaszewski was brought up, and also Katie Rock Burns with those respective topics. Are there other topics that council members would like to bring to our attention, or topics for not only for next meeting, but for future meetings, I should say, because we can't do everything all in one night. I see Patty, you have your hand raised. Go ahead.
Patty Silva. I wonder if once Cheryl Ellis is settled in and, has had a chance to, get acclimated, if that would be something that we would want to, learn about what she'd be doing. And
Sure. This is Kevin Zingler. I think that's a great idea. I don't think that's I think it's a great idea. Let's give her some time to get acclimated, and then we can maybe have her a future meeting in March or April, depending on what her schedule is.
Joe Carvalho here. I'll bring that back to the commissioner and Dr. Ellis and try to identify a timeline for that.
Great.
thank you.
Kevin Zingler again. Is there any other items or comments that the council would like to make before we adjourn? Christine, I see you have your hand raised.
Hi, I think that Kevin Bronson, did he get off? I know he's still on. Hi, Kevin. I just can't see you. You said that you would be putting up the testimony videos on the website. Are they there yet? I hadn't had a chance to check today, and I said today or tomorrow.
So Kevin Bronson, no, they will be up tomorrow. We have our illustrious Joe Carvalho sitting and listening to all of them and correcting the closed captioning. So, so Joe's doing the first one, and he's gonna fix the second one, but they're both gonna go up tomorrow morning. So let's say noon tomorrow. Check noon tomorrow, and if they're not there at noon, call me.
But what if you send me by mailgate? I'll never get it.
Actually, this is Kevin Bronson. I think I'm one of the few people in the agency that doesn't have a secure email.
And do you have a
I
direct
haven't
number?
run into that problem yet.
Thank you, Kevin.
This is Kevin Zingler again. I see Patty, you have your hand up. I don't know if it's a legacy hand or.
Yeah, hold on. I'm trying to, okay, there we go.
Trying to
unmute. Back when we were working on the testimony, and thank you all for doing such a wonderful job on that, there was an apparent issue about it getting released, and I just wondered if what happened, like too early, something like that, and I just wondered if anybody knew what happened with that.
I'm sorry, this is Kevin again. Can you repeat your question again on that?
There was a question about whether the testimony, I think, had been released early. Christine, I think it was you that had said something about it went out before it was completed, or did I misunderstand that? This
is Kevin Zingler. I can clarify that, I believe. And Christine, please chime in. So I guess there was a request by a council member at one point to have their name redacted from any testimony for privacy reasons. And the individual's name was already published on the council website several years ago, and I guess that privacy was out there. So they were fined. I did double check, just so you know, and the council know, I did double check with that individual personally via email. And once I got the green light, I submitted it to DDS for publication.
And I will just say, the breach was not within DDS. The breach was external that made it irrelevant now.
Thank you. Thank you for clarifying.
Yep. And I'd like to just, this is Kevin again, Kevin Zingler. I'd like to take an opportunity to thank Karen and Rick Rothstein for their efforts on the authoring of the testimony. They did the yeoman's effort of the testimony. And I appreciate that because we were in COVID land here where I work. So we were trying to figure out how to keep homes all open and programs running. So I appreciate their efforts in doing the heavy lifting and putting together the initial draft, and then all of us chiming in. Thank you to the entire council for that. It just proves again that together we're strong and we can do it. And this is the second time we've been able to do that in a very short period of time for testimony. So thank you again to everyone's efforts, but especially a great shout out to Karen and Rick Rothstein. Thank you for your yeoman's efforts in this process.
Kevin, thank you for the compliment, and also thank you for pulling together everybody's comments there at the end and still having it make sense.
You're welcome.
Yes. Karen Levesque, I'd like to say thank you too, but it was a team effort, and all the other council members, read through and added to the testimony, so it was everyone, and it worked out very well.
This is Kevin Zingler again. If there are no further comments before the council, I think I'll entertain a motion to adjourn at this point. Patty, you still have your hand up. Is that that's a legacy one, right? You want it? You want the floor? No, you're good. Okay, perfect. All right, I will entertain a motion from a council member to adjourn at this point until our next meeting, which will be on Thursday, February 17th at 4:30 p.m. via Zoom. Is there a motion? I see Rick Lenz raising your hand.
So moved.
All right, moved by Rick Lenz. Is there a second? I see a hand raised by Patty. Patty raised her hand. Patty Sylvia seconded the motion to adjourn. Those further discussion on a motion to adjourn. All those in favor to adjourn, please signify by saying aye. Or raising your hand.
Aye.
Anyone opposed? Chair votes aye, and we are adjourned. Thank you, everyone. Have a great day.
everyone.
Stay safe.
Have a
and we will
good
see you
night,
on-
everybody.
Take care.
Stay safe.